Acute rheumatic fever. Definition: it is a systemic inflammatory disease of connective tissue, acute or subacute, appearing as the late sequel to pharyngeal infection with group A streptococci in people with a genetic predisposition to the disease.
Now, rheumatic fever is a rare complication that can arise from untreated infections called strep throat. Untreated strep throat infections. Strep throat is a disease caused by a bacteria called Streptococcus group A that can affect various parts of the body, but is most typically associated with throat infections. Now, again, it's a very rare complication, but when a child in particular has strep throat and it goes untreated, a couple weeks later, on occasion, the child may develop rheumatic fever. Rheumatic fever is not limited to children, although it's most common between ages 5 to 15 years old. It can occur really at any age in adults. If one develops
Envelops primarily the heart, joints, and central nervous systems. Diagnosis: the clinical picture is characterized by appearance of general symptoms 2 to 4 weeks after a sore throat, remittent fever without major oscillation, epistaxis, and children abdominal pain that can lead the diagnosis.
Criteria. Now, in order to make a diagnosis of Jones, we have to find two major criteria, and we need to find one minor criteria. So, a major criteria, we can use the mnemonic Jones to actually remember the names of the symptoms or the signs. The first one, the J stands for joints. Typically what this means is patients experience migratory polyarthritis. The O stands for heart. Now the reason why is because the O is actually supposed to be in the shape of a heart. Okay, so what you're going to see is pericarditis, as well as the finding of murmurs. The N stands for nodules. Nodules are found subcutaneously. E stands for erythema marginata. Okay, and this is what is described as a serpiginous skin rash. Okay, it's snake-like. So you see these snake-like lesions in the skin. S stands for Sydenham's chorea. So what we see with this is weird facial movements, tongue protrusions. You may see upper limb chorea. Okay, those types of findings. Now your minor findings include the finding of a fever, increased erythrocyte sedimentation rate, any type of arthralgia, as well as a PR interval increase on EKG.
Arthritis. It is classic form undertakes large joints, especially in lower immigration consecutive members without sequel. Carditis. It is diagnosed by the presence of murmurs, cardiomegaly, pericardial rock, gallop ring, signs of heart failure, and tachycardia during sleep. Chorea. It is a condition of the central nervous system characterized by emotional instability, aimless, involuntary movements, and muscle weakness. Subcutaneous nodules. Subcutaneous nodules, they are more frequent when carditis, smaller, more fugitive than rheumatoid arthritis, but its location is similar periolecraniana. Erythema marginatum. It is a pink rash erythematosa, well-defined and internal diffuse, non-pruritic, felting, and short outreach. Treatment. rest, and the use of aspirin dose of about 100 mg per kilogram body weight per day. The rest should be maintained for at least 2 to 3 weeks, and if there carditis, about 6 weeks. In a presence of cardiac insufficiency, diuretics and digital rarely be used. Prevention. First, primary prevention and secondary prevention.
In order to prevent any further damage, Suliana must get penicillin injections every 28 days until the age of 21.
If you have recurrent rheumatic fever, then each time the heart gets worse. You get more and more scarring in the valves, and the heart gets bigger, the valves don't work so well, and those are the children who might need heart surgery, or they may just go along and need heart surgery as an adult. So it's that recurrent.
Primary prevention. Treatment involves what has been called eradication of streptococcus. The drug of choice is penicillin, and the most suitable preparation is intramuscular benzathine. In case of documented allergy to penicillin, erythromycin 40 mg per kilogram body weight per day used. Secondary prevention is very effective and, if performed properly, virtually eliminate epilepsies. It starts with strep eradication therapy described, followed by monthly injection. In case of penicillin allergy, can be used sulfadonoxin.